Governor, I know there aren't many states that have done test to stay, but Massachusetts has had it for a couple months now, and the pilot's been in Westerly. Why has it taken, I'll say, so long to get off the ground? Why can't you just implement it or done it all at once to save all these days from kids being in quarantine? What was the process, and again, why couldn't it have happened earlier?
Yeah, so I think that, I shared your feeling about, a level of impatience to get it done, but I also got good advice to make sure that we did it right. So the idea of getting a pilot in Westerly was a big advantage to us, because we were able to, as Anna mentioned, that it was a successful rollout. And so now we're going to be prepared to be able to do that right in Lincoln. So it's a matter of making sure that you had it right. And now going forward, we feel as though that we got a very good strategy for any district that would like to keep their kids in the classroom. As the superintendent, parents that want the kids in the classroom, now we have a great tool to do that.
I know Massachusetts is on the verge of implementing like an app system for your vaccination status. Are you at that point yet, or is that something that's coming to Rhode Island?
Yeah, so we'll have an app that, in addition to what's already available, as a convenience item to anybody in the state of Rhode Island that wants to use it, whether it's in their travels or wherever they might want to show that they've been vaccinated.
Governor, it's all very clear to us right now that the COVID corona crisis is going to be with us in terms of its physical presence for years to come. This is probably going to become something akin to being part of the flu cycle. At what point and what benchmarks are you going to use before you finally end, if you will, these endless emergency executive orders where fundamental civil rights, fundamental freedoms are taken away? And I have a follow-up.
When it makes sense. Right now it doesn't make sense.
Respectfully, the not going to make sense isn't a benchmark. We're at, by your own public relations, well over 90% in initial first stage vaccination. Citizens are actually asking for answers on this. This can't continue to go on for years, where again, fundamental civil rights, fundamental governmental rights are being taken away for a disease that appears to be becoming, sadly, part of our national picture.
Rhode Island's done very well in terms of any level of restrictions. There's no restrictions on businesses right now. There's school areas that we feel as though are fundamental. The healthcare vaccine issues were instrumental in terms of the request from our hospitals, from our nursing homes. We responded to them. If you have a crystal ball, you would know that a Delta was on the horizon in July, and we didn't. Obviously, we have to deal with what's given to us right now. This new variant, as the President said, this is not a panic. We're not expressing a panic here. We're going to be aware of what that means to us, and then once we understand what that is, we're going to inform the people who live in the state of Rhode Island about what that means to them individually, and then we'll work with the Department of Health. We'll work with all the other emergency management teams to make sure that we're making the appropriate decisions to keep people healthy in the state of Rhode Island.
Alexandra? That was your fault, Pat. We're going to move on. Thank you.
Wanted to ask if you could just clarify a couple of things about the app for the vaccination status. Is it fair to call it a sort of vaccine passport? I know it's not a requirement necessarily is what you're saying, but it is something that you're showing to people to get to a place, maybe to show them that you're vaccinated. Is it fair to call it that? And will it be something that may be more widely used amongst businesses?
Well, that'll be up to the businesses. That's up to the airports. That's up to the. We're going to make it available as a convenience to people who want to use it. You can call it what you want. We're going to. It's an app. It's an application that people can use. They're going to be able to access, and once it's accessible, we're going to make sure that everybody understands how to do it. And then, if the people choose to do it, choose to have it there for their convenience in their own lives, then it's available. It'll be available to them.
Okay. And one more question on the test to stay. How was it determined that 315 days were saved in Westerly?
My conversation with the superintendent was that they were able to get parents to agree to have their children be involved with this procedure of testing over a 7-day time frame. And so they had the option of either staying in the classroom or going home on the quarantine based on a close contact. In Westerly, they chose to keep the kids in the classroom, and so they accumulated the number of people that would have gone home that ended up staying in school, and that was the measurement of, over that small time frame. About 310 days of school time was saved, which is, you know, hundreds of hours of learning that we need to do, and that's what the superintendent mentioned. We want our children in the classroom because we know that they're going to be impacted in not a favorable way if they're not in the classroom. Our teachers need them in the classroom, and this test to stay is going to allow Lincoln to take advantage of exactly what happened in Westerly, and then what we're saying here today, that any school district in the state of Rhode Island that like to implement that, they can contact us or RIDE or the Department of Health, and we'll make sure that it gets implemented in a safe and efficient way.
Okay. Wayne?
Can you give us more detail on this vaccine passport? Specifically, what stage is it in development and when might it be available?
Tom, you want to answer that, or Doctor?
Yeah, thanks. So, one of the challenges we've been working through is the only nationally recognized proof of vaccination is that paper CDC card. And it's not convenient, it can be easy to lose. So something we've been working for quite some time is, the right national standard that will allow Rhode Islanders to travel nationally, internationally, and be recognized as a proof of their vaccination status. So that's what we've found. It's a common platform that CVS, Walgreens, many other large pharmacies are using. They're already nationwide. Many other states are also using. So we're really hopeful that in lieu of that official federal standard, this will fit that bill. So where we are right now is we're actively in user testing. So awaiting some feedback here in just the next couple of weeks, we'll be ready for a larger rollout. In limited use cases, it's available. What we're prioritizing right now is trying to test it in different environments. So to get specific about it, it's with Apple and Google app stores for broader rollout. But looking at ensuring that it's recognized for international travel with other regional partners and then other states and partners nationally.
Question over here. There was a question for you, Tom, about the name of the app.
What's the name?
Yeah, 401 Health, but we'll have that locked in once we roll it out.
Thanks. And then for the governor, right now, I believe there are several folks camped out in front of the State House, and the Capitol Police attempted to move them briefly last night. What are you telling the Capitol Police to do with those folks if they do not leave and stay in front of the State House?
So I haven't had a conversation with the Capitol Police. I was told that that may happen last night. Right now, the advocates that are talking about housing, that's why we talked about it at the front of the press conference here. We're listening to them, and they need to know that we are, and we're responding. And we've got a concrete number of 150 beds that need an addition through the coalition, through their own letter, that we're satisfying that. So my hope is that when we communicate the work that we're doing, that they'll understand that we have listened and we have actively engaged in a way that will address the issues that they're talking about.
And do you have any update on spending not just on services for the homeless, but on any of the other items that you talked about potentially using some of the leftover federal funds for?
Be more specific, please.
On any of the health and human services, either pediatrics or early intervention, or any of the stuff that's in your down payment that...
Yeah, in the down payment, we're hoping that gets acted on, and we're still confident that it will, once it's evaluated by the General Assembly, that they'll activate that, hopefully earlier better than later, and hopefully when they reconvene in January. Yeah, so we're hopeful of that, and I think the point that we want to make to the advocates is that, and I talked to them last night, we had a 2030, Rhode Island 2030 event last night, a forum in Providence at the Kazarian School, and we talked to the advocates that are talking about homelessness, and We made them aware that we have been listening. We got concrete numbers. We've established a work team in my office that wasn't actively working on that. We dispatched some high levels of skill and talent to work on it, and we're making a significant progress on the numbers that we need to deal with. And in addition to that, in terms of the homelessness, we're not going to repeat this again. And so we'll have some plan in place where we can repeat it every year going forward. And to your point, we're fortunate to have resources that I think that we'll be able to use. But immediately right now, it's about making sure that people who want to be inside in a warm place have that opportunity, and we're committed to make that happen.
We have time for 2 more questions.
You and Dr. Alexander Scott talked a lot about indoor mask wearing potentially coming back. Are there ever any plans to mandate it again? And for students in school, will that be extended, the requirement to wear masks indoors?
Yeah, so again, I think the earlier question, if you had a crystal ball, you knew what was coming down the line, you could answer that question. That's why you can't really be specific about when, what's going to happen next. Right now, we're in a position where we're just going to keep it the way it is in terms of the way that we're dealing with any of the, the protocols that we were talking about. The schools are still in place with the masks, and then in the general public, it's up, a personal decision what they do, and the doctor has, given the advice that it'll make sense to some people to be doing that, especially coming into the winter season.